Good afternoon, welcome to today's update. As usual, I will start off with the daily statistics. The total number of positive cases reported yesterday was 897. That is 4.6% of the total number of tests that were carried out yesterday. And the total number of confirmed cases now is 102,372. 225 of today's cases are in Greater Glasgow and Clyde, 150 in Lothian and 147 in Lanarkshire. The remaining cases are spread across the other 8 mainland health board areas. I can also report that 972 people are currently in hospital, which is a decrease of 11 from yesterday, and 50 people are in intensive care, which is 7 fewer than the figure yesterday. Finally, I have to report, unfortunately, that 39 additional deaths have been registered in the past 24 hours of patients who first tested positive over the past 28 days, and that takes the total number of deaths under this daily measurement to 3,989. However, National Records of Scotland has just published its weekly update, which you will recall includes cases where COVID hasn't been confirmed through a test, but is a suspected or contributory cause of someone's death. Today's update shows that by Sunday just past, the total number of registered deaths linked to COVID under that wider definition was 5,868. 232 of those were deaths registered over the course of the last week. That's 20 fewer than were registered in the previous week. 145 of the deaths that occurred last week occurred in hospital, 78 in care homes and 9 at home or in another non-institutional setting. Every single one of these deaths, of course, has, and for families the length and breadth of the country, will still be causing heartbreak. And so yet again, I want to send my condolences to everyone who has lost a loved one during this pandemic. Now, I have a number of issues that I want to reasonably briefly update you on today. Firstly, I want to take this opportunity to express my heartfelt thanks to everyone who got our COVID vaccination programme off to such a strong start yesterday. Obviously, the medical professionals who were giving or receiving the vaccine, but also everyone who worked so hard to get us to that point. And that, of course, includes the scientists, the delivery drivers, the admin staff making the appointments, the civil servants in this building who all have been working hard to get us to this major milestone in our journey through COVID. The vaccination programme is a major, enormous undertaking, and we know there are challenges that still lie ahead in it, but it was hugely encouraging. I would go as far as to say, and I'm sure I'm not alone here in saying this, it was actually inspiring to see it get underway yesterday. Tomorrow, when I give the daily update, which I'll do in Parliament tomorrow, I will give provisional figures on the numbers of people who received the vaccine yesterday or who will have received it over the course of today. Now, one final point on the vaccination programme. There may well be questions today on the advice that has been issued this morning from the MHRA, the UK Medicines Regulator, that anyone with a significant history of allergic reactions should not get this vaccine. And if there are questions on that topic, the National Clinical Director will respond to those. Second issue I want to raise is just to note that the Health Secretary will later today launch the Scottish Government's Cancer Recovery Plan. That plan sets out how we will further improve cancer diagnosis and care, for example, by helping patients to prepare in advance of cancer treatment and by establishing 2 specialist diagnostic centres to provide better support for patients. It is an important part of our overall efforts to ensure that wider NHS services are resuming and continue to improve as we go through the next stages of this pandemic and start to recover, hopefully, from it. Now, there are 3 other issues I want to touch on briefly, and they relate to 3 different publications today which may be of interest. The first is a report on COVID outbreaks amongst our student population. And the report shows that between the 1st of August and the end of November, there were almost 3,000 COVID cases that were associated with what are called student postcodes. In other words, postcodes for halls of residence and other accommodation intended specifically for students. Almost 2/3 of the cases occurred in a 3-week period in late September and early October. And overall, more than 3/4 of the cases were in Edinburgh and Glasgow. In fact, a high proportion, around a quarter, were specifically in Pollock Halls in Edinburgh and the Marano Halls in Glasgow. The research, as well as reporting on these figures, also sets out lessons for the next semester, and many of these relate to measures which were set out to Parliament yesterday by the Deputy First Minister, such as increased use of testing, staggered arrival times for students, and students reducing their social contacts both before and after travelling. The report is a reminder, if any of us needed it though, of how hard all of us need to work to reduce the risk of the virus spreading in shared accommodation. And I continue to be grateful to all students who are having their education disrupted in ways that are not fair to them, but unfortunately inevitable during a global pandemic. But I'm also grateful to universities and colleges for the efforts that everyone has made to help us curb transmission during this very difficult period. The evidence being published today suggests that those efforts have made a real difference in the past 2 months, and I'm very grateful for them. The second report is the weekly Public Health Scotland update, which should just have been published before we came in to do this briefing. This week's publication is directly relevant to the issue I've just been talking about, actually, since for the first time it provides details on the testing of asymptomatic students. It sets out that in the week from the 30th of November, 22,000 tests on students were carried out using lateral flow devices. It's worth reminding you, of course, that because we are encouraging students to get tested twice, that does not equate to 22,000 students being tested in that week. But nevertheless, that is a promising figure and shows strong uptake of the testing on offer to students. Lateral flow devices, as you've heard us discuss here before, are useful because they provide results extremely quickly, but they are less sensitive than standard PCR testing. And that is actually one of the reasons why we recommend that students have 2 tests a few days apart, and it's also why we recommend that any positive results through lateral flow devices are then confirmed by a PCR test. Details of the number of positive test results amongst the students being tested will be published next week, but the numbers are currently thought to be relatively low. And today's report does demonstrate that lateral flow testing has been widely taken up by students. So again, I'm grateful to students who have taken tests. They are helping to keep themselves and their loved ones safe during the forthcoming holiday period. Now, today's Public Health Scotland report also provides some initial details about 6 of the locations in West and Central Scotland where mass community testing has been trialled during the past fortnight. And it shows that across those 6 locations, 13,000 tests were carried out up to the 7th of December. Most of these were PCR tests rather than lateral flow tests. And in total, community testing has so far identified 426 positive test samples across these 6 centres, and that equates to a test positivity rate of around 3%. Community testing enables people to get tested even if they have no symptoms of COVID, and so the tests over the past week have identified positive cases that might well not have been identified otherwise. So these people have been told to self-isolate and have spoken to contact tracers, and that then is helping to break the chains of transmission from positive cases that might otherwise have gone undetected. And this pilot programme is showing us that community testing can play a part in controlling COVID, especially in areas with high levels of community transmission. And we will take the learning from these pilots and use that to inform a much wider use of mass testing as we go into the new year. Now, bear with me, the final reports I want to highlight today are ones that have been submitted to the Scientific Advisory Group for Emergencies, SAGE, as you are used to hearing it described. And these reports have used genomic sequencing to look at how many different strains of COVID have been in circulation during the pandemic and where they might have come from. And one of the reports focuses on Wales, the other one focuses on Scotland. Professor Leitch is going to say more about them, but they provide really important lessons for everyone trying to manage the virus in Scotland and across the UK. In particular, the report on Scotland and looking at what has contributed to this second wave of the virus in Scotland emphasises the role of travel in reigniting outbreaks of the virus after it has been suppressed. The risk created by travel, of course, is the reason that we are currently recommending against non-essential travel outside Scotland, and that is a very important part of helping to control the virus. And it's also, of course, why within Scotland we have travel restrictions in place concerning travel to and from level 3 and 4 areas. That is a vital part of tackling the virus and trying to keep it contained rather than allowing it to spread across the country. Now, the only other point I want to highlight today, I want to end on this note, is that tomorrow sees the start of Hanukkah, which of course is a time of celebration for our Jewish communities. Ordinarily, it would see people come together in each other's homes or in large gatherings, and obviously that is not possible this year. So I want to take this opportunity to give a very heartfelt thank you to everyone in our Jewish communities for celebrating Hanukkah this year in a way that will protect themselves, the wider community and the National Health Service. I very much hope you still manage to have a very special time, and please know that over these next few days you will be very much in my thoughts, and I'm sure the thoughts of many people across Scotland. And I wanted to give that particular message to our Jewish communities today. These are the key issues I wanted to comment on today. I know there was a lot of detail and a lot of figures in that, but these are all important reports in terms of our learning about this virus, and will individually and collectively, we hope, help us to manage the remainder of this pandemic in a more effective way. Before I finish, let me just remind everybody of the rules. Obviously, yesterday we gave the results of our weekly review of the allocation of levels, and from Friday, 16 local authorities are going to move down a level of protection. That makes it more important, particularly in these areas, that everybody follows the rules that are in place. This often seems like a counterintuitive point to make, but as we ease restrictions, it becomes more important to abide by the restrictions in place, not less, because by easing restrictions, we are giving the virus more opportunities to spread. So we've all got to be even more on our guard. If you're in any doubt about what the rules are in your area, the Scottish Government website has a postcode checker, and you can use that to find out. But with the very specific exemptions of some island communities, please don't visit other people's homes right now. That is really hard, but it is the most effective way of limiting transmission. The only reasons for visiting other people's homes right now should be for essential purposes, childcare or looking after a vulnerable person. If you're meeting outdoors or in an indoor public place, stick to the limit, 6 people from a maximum of 2 households. As I've said, stick to the travel restrictions. Don't car share if at all possible. Work from home if you can. Download the Protect Scotland app. I said yesterday, it's worth repeating, that from next week, everybody over the age of 11 in Scotland will be able to download the app. Up until now, it's only been people 16 and over, so that's an important development. And finally, remember facts. Remember to wear your face covering, avoid crowded places, clean your hands and surfaces, keep a 2-metre distance from people in other households, and self-isolate and get tested if you have symptoms. Thank you very much for listening to what was quite a lengthy update today. I'm now going to hand over to Professor Leitch, who'll say a bit more about the genomic sequencing and touch on a couple of other issues before we take questions as usual.
Thank you, First Minister. And just before I give slightly more detail of that interesting genomics study, I wanted to do something slightly dangerous. I wanted to isolate out some people for thanks. There are hundreds of people who have got the vaccine programme started in Scotland, including those who received and gave the vaccine yesterday. But there are 5 individuals who I want to specifically name that we want to thank especially. This has been an enormous logistical challenge, and it will continue to be for many months to come. So Lindsay McClure from National Services Scotland has led our procurement and logistics work. Greg Thompson has led our service delivery work from National Services Scotland. David McCall at NHS Education for Scotland has built the data collection app in record time. Alison Strath is our interim Chief Pharmaceutical Officer in the government and has worked round the clock to get this to where it needs to be. And finally, and by no means least, Caroline Lamb, who is the Director in the Scottish Government in charge of the vaccination programme. Deeply thank you to each and every one of you. It also gives me the opportunity to say that today is a day for thank yous to the NHS and our care teams around the country. Normally, this week in Scotland represents a big Thursday night event at the Corn Exchange for the NHS Scotland Awards. And unfortunately, we can't do that for obvious reasons, so we're having it online. The good news about that means that you can all watch. So at 7 p.m. tonight at scottishhealthawards.com, we'll be streaming the NHS Scotland Care Award. So please do tune in and watch that, and perhaps raise a glass or say something nice on social media to the 16 winners of those awards that will be announced this evening. So then to the Genomics Studies. These two reports, as you heard from the First Minister, have been submitted to SAGE, the committee you've got to know over the last few months, and they give us very important insights into the genomic history of COVID in Scotland and in Wales in the first wave of the epidemic, and also now into the early stages of the second wave. It turns out that Wales and Scotland, until quite recently, have had a very similar COVID history. At the start of the pandemic, about 300 different strains of COVID were introduced across Scotland, and as we know, the virus then spread extensively throughout the population. These reports have confirmed that following the first lockdown, the majority of the COVID virus strains that had been circulating in the population were eliminated. The report then demonstrates that as we moved into the second wave, COVID infections were caused by whole new strains of the virus that had been introduced into Scotland from elsewhere. It's been possible to trace many of these genomic strains to countries outside of Scotland, some to other parts of the UK, some much further afield. So this report allows us to say that the lockdown in the first part of the year that you all played such a huge part in did get Scotland incredibly close to eliminating the virus in our communities. But as we opened up, inevitably people began to travel across the UK, internationally on summer holidays and other travel abroad. New strains were imported again into Scotland. That will always be the case unless a country will restrict travel to the extent that countries as New Zealand and Australia have done, and it was exactly the same situation in Wales. The Welsh analysis also looked at transmission of the virus on a more local level. They found that in high population density areas, COVID cases were more likely to be associated with local strains of the disease. But in rural areas, it turns out that cases were more likely to be associated with strains from further away. They also found that in rural areas, these introduced strains rarely resulted in local onward transmission. So what have we learned from these three reports that can help us from this point forward as we begin again to reduce the transmission across Scotland? First, we've learned that the first lockdown was successful in all but eliminating the virus from Scotland. Secondly, we've learned that once as a society we are allowed to travel again, we brought fresh new strains into Scotland, which started our second wave. And in some cases from countries where the incidence of the virus was not high enough to be on quarantine lists, or from other parts of the UK where there is, of course, no quarantine. And thirdly, these reports confirm for us that the virus is much more likely to spread in areas of high population density. So as we bring the virus back under control again this time, these learning points help us with our future advice and the politicians with their decision making, especially around things like the length of quarantine, airport testing, whether that's testing to travel or testing to be released from quarantine. These reports also provide, finally, a cautionary tale to people who are considering travelling over the Christmas period. In an ideal world, we would encourage everyone to stay as local as possible, and particularly not to travel between high and low prevalence areas. If you can stay local, you will help Scotland to avoid another spike in January. Thank you, First Minister.
Many thanks, Jason. We'll move straight to questions now. Lisa Summers from the BBC.
First Minister, when you made the decision yesterday on Edinburgh, did you follow the science or did you not follow the science? Because if this is a decision made on stopping people perhaps being tempted to come to the capital city, then could you not use the legal powers to enforce a travel ban because people in the capital city feel that they're being punished because they've done everything to meet the criteria to be in level 2? And for Professor Leitch, just on the vaccine and over 80s who are not living in care homes and who are not in hospital, can you just clarify, should they expect to get this first Pfizer vaccine before Christmas, or is it much more realistic to expect them to be able to get the vaccine when another vaccine like the Oxford vaccine comes on board?
Thanks, Lisa. I'll hand over to Jason on the vaccine question. Look, I understand how frustrated people in Edinburgh will be. I think people across the country who are still living in, many parts of the country right now are still in level 4 restrictions. Many parts of the country from Friday will still be in level 3 restrictions. This is difficult and frustrating for everybody, but these measures are essential to try to keep this really infectious virus under control. Maybe just a couple of contextual points. This is not about punishing any area. The idea that we somehow take these decisions on the basis of, well, we like this area and we don't like that area, or one of us lives in one area or not, that's just not a factor in our decision making. And I think most reasonable people would accept that that is not the case. I want every part of Scotland to be living as freely as possible, as quickly as possible. But I have a duty to try to keep the country as safe as possible, and that means trying to suppress the virus. The second point, which I suppose goes to your question, do we follow the science or not? And you've heard me say this before, I really wish these decisions were as easy as, almost following an algorithm that you put some data into a computer and the computer, sort of churns out the answer for you. It's not. Yes, we look at data, we pore over data. I've looked at more data for every single part of the country on a daily basis than I have ever done in the rest of my life put together over the past few months. I spend huge parts of my day looking at data, questioning data, asking people like Jason questions about what the data means, what the correct interpretation of the data is. It's really, really important. But unfortunately, and this is something I've learned over the past few months about managing a pandemic, it doesn't lead you automatically and in a really easy fashion to the answers. You have to apply judgment, you have to apply contextual factors to that. But even just on the data, I gave you the breakdown of today's cases, and this has been true over the past few days. After Greater Glasgow and Clyde right now, the part of the country with the highest number of cases on a daily basis at the moment is Lothian. And within that, Edinburgh in recent days has seen a bit of an increase in cases. And over the past wee while, Edinburgh has been, not increasing wildly, but not decreasing hugely either, and therefore we just have to take a cautious view of that and recognise that, particularly in a city, Jason's just been talking about the increased risks in urban areas versus rural areas. We have to be careful and cautious, because if we take an area down a level, that does not mean everything stays the same. Obviously, it means places open up, so the virus is more likely to spread. And if you take that decision before being really sure that an area is stable enough to cope with that increased transmission without it tipping it back into crisis, then you have to be cautious. And that, because if you're not, you send it back on this journey rather than move it forward. And these are really tough decisions, and they are decisions that we take very, very carefully, and will continue to do that. And I hope we will see Edinburgh move down a level in the weeks to come. We will review it again next week, but we have to be careful about this, or in a few weeks' time you will be asking me why we've done something that has sent Edinburgh's cases skyrocketing again, and we're having to put even more severe restrictions in place. So we'll continue to try to get these decisions as right as we possibly can. And as evidenced yesterday, there is not a single part of me wants to keep an area in a higher level than necessary for any longer than necessary. It's in nobody's interest, not in the interest of the people living in an area or in the interests of the businesses operating in an area, and it's not in my interest either. It's not. No politician wants to take unpopular decisions. So the fact that I'm taking decisions sometimes that are not popular in particular areas should maybe lead you to think that I really do think these are necessary decisions. I'm not taking them lightly. Of course, the Finance Secretary will set out later this afternoon some additional support over the winter for businesses that are still dealing with the impact of these restrictions.
The answer to your question to me, Lisa, depends almost entirely on two things: vaccine supply and logistics of the vaccine. The top priority list is vaccinators, health and social care workers, care home staff and residents, and those over 80. And they could be in hospital, in care homes, or in their own homes. Some of them will be able to travel to where the vaccine is, and that will make the logistics a little bit easier. But the reality is this vaccine is in short supply just now. We got a few 10,000 doses. We're expecting a few more 10,000 doses next week, and we're hopeful that will continue on a rolling basis. So people should be patient. They should wait to be contacted, and we will get to that over 80s group just as fast as we can. The reality is much of that will be into next year, but there may be a few, as vaccine supplies allow, in regions of Scotland who might get that before January. I think the majority of it will be into January.
Thanks. Kirsty Clark from STV.
Good afternoon. I would just like to ask a wee bit about the reaction to this vaccine. What is the Scottish Government and the Scottish NHS's reaction to the news that people have been taking an allergic reaction if they've previously had severe reactions to medicines, vaccines and food? Has anyone in Scotland reported a reaction yet? And what does it mean for the rollout to the likes of care homes if we're asking for resuscitation methods to be in place if people do take a reaction to the vaccine?
I'm going to hand over substantially to Jason on this question, because I think it's important people hear a clinical voice, particularly on use of the word resuscitation, which I've asked Jason this morning. What do you mean by that? And it doesn't mean what I think most of us non-clinicians would automatically think there. So Jason can give a little bit more on that. The point I would want to make, just to be clear, I think I saw you tweet earlier on, Kirsty, saying if anybody's had a reaction to this vaccine in Scotland, get in touch. We are not aware at this stage of anybody in Scotland having the severe reaction that has been reported in 2 people in England. There is it's called the yellow card procedure with vaccines, so any reactions like that are very carefully recorded. That's why we know about the ones in England, and the MHRA have been able to issue the advice they have today. Again, I'll leave Jason to say more about this, but anybody that's had any vaccine, people will know you can sometimes get a bit of an itchy, sort of patch where you've had the vaccine or things like that. So what we're talking about here are severe reactions, and we have not had any of those reported in Scotland. And if that was the case, in the same way that is recorded through the normal processes or has been in England, that would happen here as well. But I'll hand over to Jason, who will take you through some of this from a more clinical perspective.
So we take this very, very seriously, as you would expect us to do. This is a rare event, but actually, to the clinicians in the vaccine programme, this is not entirely unexpected. I don't wish to seem cold. It is rare, but not unexpected. If you go to the Green Book, which is the kind of Bible of vaccination that we all know, those of us who have run vaccine clinics or been in these allergy clinics, there's a new chapter in that book for COVID, chapter 14. We've not had that chapter before, but chapter 8 has existed for decades. Chapter 8 is the emergency chapter. What you should do, what training you should have, what equipment you should have. That chapter says you should have resuscitation equipment and you should be trained in resuscitation if you're running a vaccine clinic. Now, the First Minister's correct. That is not the resuscitation room from casualty. That is an anaphylaxis pack. That's been around for decades. That includes some adrenaline pens. It would include a syringe. It would include everything that the trained individual, the nurse, the doctor, the dentist who might give the vaccine is trained in using to allow us to do that. That doesn't mean we should take these incidents lightly. The yellow card scheme exists so that all 4 countries knew at midnight last night, and we had calls overnight and this morning about the advice that would go out. And Pfizer have put out a precautionary note to say that we should make sure we ask every individual who's having the vaccine, have you ever had a reaction to a drug, a food, a severe reaction, a severe allergic reaction that's required you to have adrenaline or required you to go to an accident emergency department? And for them, for now, until we see how the numbers work out over time, they will not be receiving this vaccine. But again, let me go back to the beginning. Rare, but not unexpected. We take it seriously, as we will any adverse events that happen over the next few days, weeks and months.
Thanks. Tim Backshall from ITV Border.
Good afternoon. First Minister, you announced yesterday that you're lowering the levels in southern Scotland. That means that somebody from here could go to a level 2 area elsewhere in Scotland, but not the relatively short distance over the border here into England, where in Cumbria the infection rates are lower than in many level 2 areas in Scotland. One local MSP, Colin Smith, says that's discriminating against border communities. Does he have a point?
How can I put this bluntly? No, he really doesn't. There is no aspect of my decision-making or our decision-making here that's about discriminating against anybody. Jason is just taking you through a scientific report using genomic sequencing that tells us that after we had suppressed the virus so firmly in the summer, What reseeded it into Scotland was travel. Travel sometimes from outside of the UK, but also travel across the UK. We're trying, as we get it under control again, to stop that happening. Now, south of the border, there are areas not far south of the border that have higher prevalence than the borders in Dumfries and Galloway do. But we are also just trying to restrict travel generally to avoid, as far as we can, the risk of people travelling somewhere that is maybe got more of the virus than in their home area and bringing it back. And these things, I didn't come into politics to restrict anybody's right to travel within Scotland or from Scotland to other parts of the UK or further afield. But I didn't particularly foresee when I came into politics of having to lead the country through a global pandemic either. These are just the necessary things that we are having to do. Actually, if you read this genomic sequencing report, it would not be an unreasonable conclusion to say we should have been much, much tougher on travel restrictions earlier in the year. And I think that is, as I say, not an unreasonable conclusion. But we've got to learn lessons from that, and that's what we're trying to do. So if you're being restricted from travelling, it's not because we're discriminating against you or anybody else, it's because we're trying to keep you as safe as possible from this virus until we get to the point where we've vaccinated significant numbers of the population and we can all go back to living much more normally, including travelling freely within Scotland and across the UK. Fraser Knight from Global.
Thank you, First Minister. I just want to ask you a couple of questions about the changes in restrictions, particularly in levels 4, going down to level 3. Seen a report this morning that hairdressers will be allowed to open from 6 a.m. on Friday morning. I was wondering, first of all, can you confirm that? And also, you've allowed retail shops to open from 6 a.m, but restaurants will not be allowed to. We've seen some shops saying that, they're planning on opening for 36 hours solid on Friday to try and make up for some lost sales. What difference do you think one day will really make if, you're keeping restaurants shut on Friday and they're not allowed to open until Saturday morning, essentially?
Look, these are good questions, perfectly legitimate questions, but we have to make judgments all the time. One of the things that I think we've all learned is there's no perfection in any of this. There's no straightforward black and white answers. The decision, we took a decision to allow retail to open at 6 a.m. and yes, hairdressers are included in that definition of retail, so I can confirm that. But the rationale for that, and this came, we had a discussion, not me personally, but others in the Scottish Government had a discussion with the retail sector, and they made a fairly cogent case for this. And it went along the lines of, if you have a 6 p.m. opening, then retailers will open at 6 p.m. and you may get more of a rush into a few hours of being opening. So it may be more likely that you would get crowds of people trying to get to the shops. And then the first full day of opening would be Saturday, where people are less likely to be at work. So again, you would perhaps be more likely to get people coming in larger numbers to the shops. So the argument went that if we opened at 6 a.m, that would allow retailers to manage that flow over a longer period. And that's the rationale for that. I don't think the same rationale exists for restaurants. And, remember here, we are trying, albeit that we're trying to get businesses able to trade as normally as possible, we're also saying to people pretty bluntly, we want you to continue to restrict your interactions as much as possible. So think carefully about, whether you need to go to the shops, 2 or 3 days in a row, or whether you can do your shopping in one go. Think carefully about the other things that you might choose to do when you're out shopping. I absolutely want people to support businesses as much as they possibly can, but right now, thinking about doing that online, thinking about doing that much more locally than normal is definitely the way we should all be thinking about it. And I would say to retailers, please be responsible in this. I'm not going to stand here and comment on things that you've picked up on social media about 36 hours continuous openings. Retailers have to be responsible for their own sake, because if what we find over the next few days as we start to open up in these level 4 areas, non-essential retail, is that we have crowds of people at shops and the virus starts spiralling again, then I can't rule out having to be standing here shutting down non-essential retail for a period. It's in nobody's interest right now to be anything other than measured and responsible in this, so that we can try to find that equilibrium as best we can, where we can suppress the virus but allow as much normality in our lives as possible. As soon as we go too far in the direction of opening up and people being encouraged to come out and interact in large numbers, the virus will spiral out of control and we'll end up with tougher restrictions having to be in place. So, this is I feel as if I just stand here every day, restricting everything that people want to do, particularly as we get closer to Christmas. But this is hopefully a once-in-a-century pandemic we're living through right now. We've got a vaccination programme just underway and it will take time to complete, but it gives us hope. It's in all of our interest to continue to keep the heat for a wee while longer and just be responsible and think in everything we do about, are we giving this virus an opportunity to spread? Because if we do that, we're going to take ourselves backwards before we get to the end of the tunnel, rather than continue this slow and steady journey through it towards the light that is there at the end of it. If that wasn't enough of an appeal to people's common sense, I'm going to hand over to Jason to do it a bit more.
I would only add, I think, or underline rather than add, the reason we're opening retail at 6 a.m. on Friday is to allow people to stagger their visits, not allow them to do more shopping. You can't, maybe you missed it, but we didn't. The images of Regent Street last weekend, it looked like normal Christmas shopping. And it filled me with absolute dread for London's numbers. And London's numbers today are up. It is as simple as that. And I see on social media talk of London moving into a higher tier within the English system. That's exactly what we want to avoid. We need to not have people crowding in whatever sector that is. And retail, as it begins to open before Christmas, is a risk. Retail doesn't think the transmission is happening there, but no sector thinks the transmission is happening in their sector. So that's why we're suggesting staggering that, which I think is smart from retail, but that requires retailers to be very responsible for us, to help us manage the queues, manage the in and out, manage the alcohol sanitizer, etc., etc. I'm confident they'll be able to do that for us, but that's why we made those choices.
Sometimes the science is not as complicated as we all think science is. This virus transmits when people come together in close proximity. If they do that in a shop, it will transmit in retail. If they do that in restaurants and pubs, it will transmit there. If they do that in their own homes, it will transmit there. It's people coming. This is what makes it so hard to try to manage this, because it is about stopping the human interactions that all of us love and value. Hopefully we're not going to have to be doing it for too much longer, but it's really important that we continue to do it over this next period, or we will end up taking ourselves backwards. So please, please, please be responsible over the next period. Natalie Crawford from Bauer.
Thank you, First Minister. This morning, Clyde One's hearing about the particularly lonely and isolating time facing parents of children who have disabilities. In England, it's now possible for them to bubble up with another household if their child is under 5, irrespective of the number of adults in either household. Are there any plans to introduce this to Scotland? And if so, would you consider extending it to include all children with disabilities under the age of 12?
So thanks for raising that. I did see the report that Radio Clyde has filed this morning, and the plea from the mother of the disabled child there. I can't give a definitive answer right now because I've not had the opportunity yet to discuss that with my clinical advisors, but I will certainly do that. Nobody wants parents with children with disabilities to feel any more isolated than this pandemic unfortunately makes inevitable to some degree for everybody. That's why we formed the extended household concept, which is, where if somebody is living alone or alone with children under the age of 18, they can bubble up and form an extended household with another. But of course, that doesn't apply where there are multiple adults living in the home. So I will look at that carefully. I will take advice from people like Jason and the Chief Medical Officer. And if we feel that it is safe to make a change there, we will do that. I suppose the one caveat I would put on is that not every child with a disability, but some children with particular disabilities may be particularly vulnerable, so we have to be particularly careful, but we will consider that and come to a conclusion of that as quickly as possible. Greg Fluker from Kingdom.
Good afternoon. With FIFA under level 3 restrictions until at least a week before Christmas, there are concerns from business leaders here about the impact on the Christmas trading period. What information can you give firms that are hoping to be able to open up more for a few days before Christmas? And can you give us any detail on what restrictions will apply to the likes of hospitality premises during the 5-day window over Christmas itself?
The restrictions that will apply to hospitality during the 5 days where we have decided to ease restrictions for individuals in a very limited way, and we're asking people to think very carefully about whether they take advantage of those. But for hospitality and others, the restrictions will be the restrictions that are in place within whatever level your local authority is in. I cannot look ahead to next week's review. We just concluded this week's review yesterday. It would be premature and utterly speculative of me to do that, but we will have another review next Tuesday. Barring developments or changes in the levels of the virus that would force us to act over Christmas, we are hoping that what we decide next Tuesday will last through the Christmas period, and then the next review would be in the first week in January, but I'll set that out next Tuesday. The final point, well, two related points I would make to businesses. I really understand how tough this is for businesses. I hate all of what we're having to do right now because the impact on people and businesses is harsh and horrible. But I don't do businesses any favours if I agree, and the Scottish Government agrees, to ease restrictions in any area prematurely, because it relates to some of the answers that I've given so far today. What happens then is the virus will get out of control and we'll end up having to put even tougher restrictions in place. So I know that's a tough thing for businesses to hear, but in a situation like this, I have a duty to be, frank and blunt with people about the challenges we face. But we also know that particularly over Christmas, for many businesses in many different sectors, Christmas is, one of the busiest trading periods, if not the busiest trading period of the year, when they will make a lot of their profits. So we understand the particular pressures there, which is why later today the Finance Secretary will set out some additional help for businesses over the winter period. Tom Eden from PA.
Thank you, First Minister. Good afternoon to you both. I just want to ask about Scottish Care today have said that the vaccine in care homes, there's some sort of insurance issue which prevents care home staff from giving the injections to residents. Can you give any details about what the plan is and who will be administering the vaccines in care homes? And just another one on, as we approach Christmas and New Year, I was just wondering if the government had any plans to mark or commemorate the sort of massive loss of life this year from the virus.
I just briefly on that point, it's something that's very much in my mind. I think at some point we will absolutely and rightly want to commemorate the loss of life from the virus. I think it's important that we, as best we can, decide on anything that is a longer lasting remembrance and memorial in consultation with some of those who have lost loved ones to see what would make most difference. I'm sure we will all, in our own individual ways, mark the loss that has been suffered this year, but whether we do that in a more formal way, we will take a bit of time to consider. I've just, before I came down here, was looking at I asked children to send in pictures of, send in pictures that I could choose one to be the image on my Christmas card this year, and I've just picked the image that will be on the Christmas card, and I'm not going to say what it is, it's lovely and poignant, but inside the Christmas card we have chosen to put just a little bit of text making that point that we have all, been really upset by the loss of life this year, and it's important that at this festive season we do remember those who've lost their lives, but also, and I think particularly for our young people and in memory of those who've lost their lives, we do start to try to look forward with a bit of optimism. And I think trying to encapsulate all of these emotions all of us feel right now over the festive season will be important, and for nobody more important than the families across the country that are grieving the loss of loved ones. Jason.
It's a slightly niche point, Tom, so I'll try and do it relatively quickly. This is to do with regulation rather than insurance. The MHRA decide which vaccine you can pack down into certain sizes and who can inject them. In Scotland, we have wholesale pharmaceutical licences in 3 of our health boards, including the ambulance service. only they are allowed to pack down the Pfizer vaccine because of the nature of its logistics, the deep freezers, etc. So then when you then move that vaccine to a new location, somebody employed by that organisation has to go with it and give the vaccine. That won't be true forever, probably, of the Pfizer vaccine, and it won't be true for every subsequent vaccine. So that will change, and trained care home staff, including nurses, will be able to give future vaccines, I'm certain. But for now, just because of the regulatory approvals required, for now, the packing down, the injecting, has to be done by a nurse employed by that health board. And that's why there's a little bit of a challenge about getting this vaccine to care homes, as well as the logistics of the frozen nature of the vaccine.
Thanks. Tom Martin from the Daily Express.
Hi, thank you, First Minister. Could I just return to this genomics study that you've been talking about? And you mentioned in an earlier answer that it might not have been an unreasonable conclusion to be a bit tougher on travel earlier as a result of this study. I was just wondering how will this study affect your thinking or the government's thinking going forward when looking at restrictions around travel? And if I may, could I just check, is there a review date set around the issue about travelling to other parts of the UK? If I could get just some clarity on that.
We review it regularly, so we do a weekly review of the levels, and we're also, in terms of the law, required to regularly review that. I think the findings of these reports, which obviously are being reported to SAGE formally, I've had an awareness that this was the emerging sort of findings out of the genomic sequencing for some time now. I've sort of made references publicly to the fact that we think, and actually sort of been, I don't know if this is the right word, but it's the only one that comes to mind right now, in some quarters ridiculed for saying this earlier in the year, that we did come very close to eliminating the virus in Scotland in the summer, and then it was reseeded from travel. And I think when I first made that point, which was informed by some of the genomic sequencing work that I knew was underway, I got accused by some of trying to be divisive and stop people travelling from from Scotland to England. So it's none of that. It's just being very, very aware of what the greatest risks of the virus spreading are, and trying to act on the basis of the best knowledge we have in ways that are most effective at stopping that. So that kind of developing understanding that we've had in recent weeks has already made us take a much more rigorous approach to travel restrictions as we've applied the levels in this second wave. And we decided a couple of weeks ago to put those restrictions in law, both for travel within Scotland and travel between Scotland and the rest of the UK. And I've, and this is absolutely legitimate, I'm not complaining about it, but I've probably had more political criticism for doing these kind of things, including criticism from sections of the media, than for many other things in the course of the pandemic. But I think these reports that we're talking about today demonstrate why controlling travel, particularly when the virus is spreading quite vigorously, is a vital and essential way of trying to both get it under control and keep it under control. And it is going to have to continue to be one of the things that we have in our consideration as we go through, hopefully, the final stage of this pandemic. Do you want to add anything?
I would only add that we've said many times from here, apolitically, that one of the key interventions in an infectious agent spread is travel. I mean, if you have a classroom with a measles outbreak, you wouldn't let that classroom travel to a classroom that has no measles. It's as simple as that. It could be Elgin that has the infection. It could be Scotland. It could be the UK. You have to decide where to draw the travel lines. That's not a decision for me. But I can tell you that if you move people from an area with infection to an area without it, you are likely to seed the infection into it. And that's what we've done now twice in Scotland. That's how the first wave reached us, inevitably, because it started in China, came through mainland Europe, came to the UK. And now we know that the second wave, in the main, not entirely, in the main, came from newly imported cases into the UK and into Scotland from Europe and from further afield. It's a basic public health standard piece of advice.
And it's not, it works both ways. It may well be that we've taken it to other countries as well. So this is not about, other countries bringing it to Scotland. We will have taken it to other countries too. And sometimes when I talk about this, maybe I don't get that two-way part of the the process here across as well as I should, because obviously I'm thinking about protecting Scotland as much as I can, but it does cut both ways. So every time one of us travels to another part of Scotland or another part of the UK, we are risking taking it there as well as risking bringing it back. So, you know, it's just one of these things that we all have to be mindful of. Simon Johnson from The Telegraph.
Good afternoon, First Minister. I just wanted to return to this Edinburgh issue. The evidence paper the Scottish Government published yesterday basically said that, it seemed to say anyway, that Edinburgh met all the public health criteria to move to level 2. For example, the number of ICU bed capacity by the 1st of January is projected to be about a third of capacity a fifth of capacity that's met, and that compares with around half in Grampian in level 2. So are you holding Edinburgh to a different and higher standard than the other 31 local authority areas because of its status?
Why do you think I'd be doing that?
Well, because you mentioned the Christmas issue yesterday, and certainly people are attracted to the capital.
They're attracted to
Christmas,
Glasgow
so that's
as well.
one potential issue.
I just want people... Sorry, Simon.
Can I ask, what would it take for Edinburgh to be moved to level 2?
So I just want, I apologise if that seemed a bit grumpy there to Simon. I wasn't meaning to be, but I just ask people when questions are being put to me along the lines of, you know, Simon perfectly legitimately doing, are you holding Edinburgh to a different standard? I just want people to sort of pause and think, why would she be doing that? You know, yes, the capital city, people in a normal festive season would come to the Christmas market and such like, but that's true of Glasgow or, you know, for people in the Highlands of Inverness. Why would I be just deciding that I wanted to pick on Edinburgh? I mean, it just doesn't make any sense. I want our capital city to be open and free and businesses trading and people coming to visit it as much as anybody does. The second point I would make, and I've made this point repeatedly since we first established the levels approach, that the indicators, the data, so we have 5 indicators for each local authority area that we look at, and they are important, but we also have to think about the real world effects that are applying in or around different areas as well. So, for example, Dumfries and Galloway probably could have, and did actually make the case 2, 3, 4 weeks ago that they should have moved down to level 1, but we took a decision that said actually they were surrounded by higher prevalence areas, so it would not have been a very safe thing to do. We have now decided that with other contextual things taken into account, that is a safe thing to do. A few weeks ago, we looked at Angus and Perth and Kinross and said, well, they don't quite meet all of the indicators yet for a move up, but we're going to do that on a precautionary basis so that it doesn't spiral out of control. So we have to apply judgment to these things. And that is true of Edinburgh as well. Lothian is City of Edinburgh, Mid Lothian, East Lothian, West Lothian. West Lothian's been in level 4 for the past 3 weeks. We see a rise in cases in Mid Lothian as well right now, and also East Lothian, which did go down a level a couple of weeks ago, a bit of a rise there. And cases in Lothian are rising. And in the most recent days, we've also seen a bit of a rise in cases in Edinburgh. So looking at all of that, we have to ask ourselves the serious question. If we think cases across Lothian, including in Edinburgh, might be rising a bit at worst, but at best not really declining, does it make sense to open things up, knowing that that will give the virus, on a basis that might not be as stable as we want it to be, the opportunity to spread again? And so in 3-4 weeks, I might be standing here saying the situation in Edinburgh has got much, much worse and we're having to put it into level 4. So I know these things are really difficult, and I know I find them, you know, difficult sometimes to get my head around all of these different factors that my clinical advisors are saying we have to take account of. But we're not taking... I would have loved to stand up yesterday, 3 weeks before Christmas, and say the capital city's more open again. As a politician, politicians tend to like to do popular things. I would have loved to have done that. So I'm just asking people, the fact I didn't do it was not to pick on Edinburgh. I love Edinburgh. It was not to pick on Edinburgh. It's because I think it is essential to take that cautious and safe approach. And I know it's difficult, which is why Kate Forbes will announce more financial help for businesses. But I'm not taking these decisions for no reason. The day I can stand here and say the whole of Scotland is open again, there are no restrictions, go back to living your life normally, will be the happiest day of my life. And I can't wait to get there, but we're not quite there yet. Paul Mallock from the Courier.
Good afternoon, First Minister. I'm wondering if you could update us on what discussions you've had with the UK government, the Scottish Government has had with the UK Government to stop disruption to vaccines and medicines, which could be brought about by a no-deal Brexit on January 1st. And with that in mind, will you be advising your MPs to vote against any deal that's brought before Parliament before that date?
I, by definition, can't answer that question because I don't know what the content of a deal will be. If there is a deal, we may see progress on that tonight when the Prime Minister meets with the President of the EU Commission, but I don't know. I'm not in that room. I'm not party to these negotiations, but we'll judge things as they become clearer. There are contingency plans around vaccine supplies and medicine supplies, and we look at those as the Scottish Government. There are also Four Nations arrangements to secure these supplies. But there's no doubt at all that these things will be much more difficult. I'm talking here in the broader medicine supply, not specifically about vaccine, much more difficult if there is not a deal agreed before the end of the year. Rachel Watson from the Daily Mail.
Thank you, First Minister. I just want to touch on schools slightly. Yesterday, John Swinney announced that higher and advanced higher exams won't take place next year following the disruption to the education system during the pandemic. Is this an admission that blended learning hasn't been working in schools? And if so, what will the Scottish Government to improve that to stop any further disruption in future?
No, it wasn't an admission of anything of the sort. It was a recognition that when significant numbers of young people are having to self-isolate to try to break the chains of transmission of the virus, which is not good for the young people having to self-isolate, but we judge that that is better than having the school system in its entirety closed so that the majority of young people are getting a normal school experience most of the time. But when young people are out of school, even if it is blended learning, then there is a risk that they are at a disadvantage to those that have been in school for all of the time, particularly where young people might have had to self-isolate on more than one occasion. And there has, as we've looked at the data and the detail of this, we think that disproportionately is affecting young people in deprived areas. So it's a recognition of that. None of this right now is perfect. None of this is what we would be choosing to do in an ideal world, but we're trying to reach judgments that are as fair as possible to the majority of people. And when we're talking about young people's education, I think it's more important than on anything else. And we'll continue to work through the Education Recovery Group to make sure that we are taking all of the appropriate steps to minimise as far as we possibly can the disruption to young people's education. Chris Musson from The Sun.
First Minister. King's College London's Professor Tim Spector, who's in charge of the COVID symptoms study, which I think you and Professor Leitch will know about, he said this week that a lesson from Wales is that rapid changes and short-term lockdowns can be counterproductive and that longer-term plans are likely to be most successful. So I just wanted to check, is the strategy in Scotland going to continue to be weekly reviews and short lockdowns like we've seen in the Central Belt, or would you consider moving to a more consistent long-term plan? And just on the genomic study, you said it showed high population density as a key factor in transmission. So shouldn't Scotland be doing far better than England in terms of suppressing the virus, given we have a population density which is, I think, 6 times lower than England?
We are doing far better at the moment in suppressing the virus. I don't have the figures, the per 100,000 figures in front of me right now that are bang up to date, but if you go back earlier in the week, in fact I think the BBC published a graph on one of their stories that showed the Four Nations sort of trend lines, and Scotland is well at the bottom of that. I don't see that as any kind of boast, nor do I see it as any sort of reason for complacency. This is a daily battle to keep this virus suppressed, but prevalence rates are lower in Scotland than they are in other parts of the UK. I've not seen, Jason might have, I've not seen the particular comments you refer to around what you described as lessons from Wales. What I would say, and what I'm about to say does not should not be read as any comment on the decisions the Welsh Government have made. But obviously in Wales there was a 2-week fire break which was almost a complete lockdown, followed by a period of very, very substantial easing up. And I think differently in Scotland, we have the level system where, yes, there are periods where an area might be in the highest level, which has been the case for 11 councils in the past 3 weeks, but we're not then taking them to a complete opening up scenario. So that's why we have decided to take these 11 local authority areas down to level 3 for a period, even when I think 3 of them, looking purely at the indicators, which, as I've already said, we don't do on an exclusive basis, but looking purely at the indicators, 3 of them I think could have made a case for going down to level 2. So we are being cautious and trying to get a steady an approach rather than an approach that sees a move very quickly from very tough lockdown to very substantial easing up. I don't think any country's got the perfect way of doing this, but that graph that I spoke about that the BBC published, which is just taken from daily published information, would suggest that perhaps that steady approach that we're taking in Scotland so far, and I stress so far because we should never rest on our laurels with this, may actually have been working to keep the virus at a more suppressed level. But we continue to learn as we go. One of the things we will be taking a bit of time over the Christmas period to consider is the content of the levels. One of the questions we have looking at the experience over the last few weeks is that is a particular level, whether it's 3, 4 or 2, does it have the same impact in all areas? And we think there is the possibility that a particular level will have a different impact in an urban area to a rural area. Are all of the restrictions in each level, are they all, right? Are they as effective as possible? So we'll be looking at the content of levels based on our experience so far. And yes, we will be considering whether weekly reviews continue to be appropriate or whether we might move to an approach where we're reviewing every 2 or 3 weeks, but we haven't come to any final conclusions on that. And I suppose the final point I would make on that is just because we review every week doesn't mean we make changes every week. In fact, for the majority of council areas, there have not been weekly changes. They've been in the levels they're in right now for quite some time. I don't know if you've got more of a awareness.
I haven't seen
comments.
exactly what Tim said on this occasion, but I don't disagree with him that yo-yoing in and out of lockdown is not the way to do this. I don't think that's what Wales have done either, though. Tim's work using the COVID symptom app has been hugely helpful across all of our countries, in fact, internationally, and I would commend the app to people who don't have it on their phone. It's just another way of helping. We do have a strategic aim for COVID in Scotland. It's in the strategic framework document that the First Minister announced a number of weeks ago, and it is to drive prevalence down as low as possible. We don't think the way to do that is to open and close, open and close, open and close, like you see in some states in America, for example. We think the way to do that is take a considered, evidence-based approach in our advice and then judgments are made across a regional basis across the whole of Scotland. Now, some of your colleagues, Chris, have criticised us for holding local authorities too long in a specific level, and then we also get criticised for moving them in and out too often. I think we've got the balance of that about right in the first few weeks, but as the First Minister says, as we approach this hopefully slightly calmer period over Christmas, one of the things we're going to do is we're going to look at the levels, the frequency of those reviews, and make sure we're doing all we can to get that prevalence down.
Alistair Grant from the Herald.
Sorry, did you address the issue to do with high population density?
I thought I kind of had in the generality, but if Jason wants to...
I think the fact remains, in the world, the global literature says, well, it makes sense, doesn't it? COVID's no different from any other infectious agent. The more people, the more spread. Scotland has, although on average, a population density that's lower than England. If you think about how Scotland lives, a lot of Scotland lives in a J shape in cities. So we do have quite a lot of high population density areas. And if you look at the numbers, it would follow along with the research that says higher prevalence in higher density areas. So I think the English-Scotland comparison is maybe slightly unfair, but the low density, high density thing plays out both in England and in Scotland.
I thought I had addressed it. Forgive me if I didn't do it fully enough, but I think your question was, does the... Shouldn't we
It
be
was,
doing
it was
better?
that explanation that Professor Leitch gave that I was looking for. Can I just point out as well that Professor Spector had told us this morning that, I know you said we are doing better than England, but he pointed out to us this morning that according to the COVID symptoms study, cases in Scotland are still higher than in England on average, is what he said. So can I just put that to you?
I haven't seen those comments, so I'd want to know on what basis. As Jason said, it's a very highly respected study, so I wouldn't be standing here wanting to contradict it, certainly not without seeing the comments, and probably not even then. But what the figures so if you look at cases per 100,000 right now in Scotland, they're about 100. That's the average across the country. That is lower at the moment than in any of the other three nations. Now, the COVID symptom study looks at a different measurement and assessment because they're looking at people with symptoms, not confirmed tests. And of course, the ONS work is looking at something different. So we take all of these things, but on the confirmed cases per 100,000, we are quite a bit lower than the gap between Scotland and England is narrowed as a result of the English lockdown, but we are quite a bit lower still than England, and even more so, I think, than Northern Ireland and Wales. Within Scotland, though, there are, and this is partly the explanation about population density, that 100 cases per 100,000 across the country masks, variation. So in Glasgow right now, it's under 200 now, but it's closer to 200. In the Highlands, it's about 25 per 100,000. So there are wide variations there, which is why significant parts of the country by land mass, if not by population, are living at level 1 with the not quite the lowest level of restrictions, but the second lowest level of restrictions. So I hope that answers the question to some extent, but if there's more once I can actually see the comments you're referring to, I'm happy to expand. Alistair Grant from the Herald.
Hi there, thanks very much. Just on Edinburgh again, given that the imminence of the Christmas period was specifically referenced yesterday when you were explaining this decision, is it actually likely that Edinburgh could move down to level 2 before Christmas? Because surely that issue will just remain next week. And can I also just ask as well, with the vaccine now being rolled out, but also bearing in mind the role of travel in spreading the virus, should Scots feel confident to book a summer holiday abroad next year? What would be your advice around that? And do you plan to book a holiday next year?
Yeah, I haven't given any thought to my holiday plans next summer. But no, I wouldn't be right now booking a holiday for next, not because I don't hope that we are in a much better place next summer, but right now I think we've all just got to focus on getting through this. I very much hope that, the prospect of being able to travel by next summer will be there for all of us, but it would be, I think, a bit foolish of me to stand here right now and advise people what to be doing next summer when we're still trying to navigate our way through this pandemic. I don't really have anything else to add on Edinburgh. I've tried to give pretty fulsome answers on Edinburgh, tried to explain the nuances and the factors. We will review it again next week, and I don't think it is reasonable to ask me on Wednesday, the day after this week's review, what the outcome of a review next Tuesday will be. We'll set that out when we get to that point. Do you want to say any more about travel, holidays?
So my advice from the podium in recent weeks has been and remains, don't book a non-refundable holiday for next summer. I wouldn't commit. I won't be committing. I'll be telling my family not to commit to a summer holiday. But I think the world will look a lot different next summer. I think this week and the emotion that many of us felt yesterday when we saw those first vaccines, I think that is genuinely the beginning of a new normal. I'm just not entirely sure of the timing. And remember, as we've said many, many times, this is not a Scottish problem. It is a global problem. So where would you travel? There's going to be all kinds of challenges about what other countries have done with vaccination, with immunity. So it's all very, very complicated. So I would hold back for now. And if you're going to book something, I would make sure it was refundable.
That last point Jason made is actually probably the most important one in travel. Even if we had managed here in Scotland, which we hope we will, to get a degree of normality back by next summer, we don't know that that will be the case in all other parts of the world. So it may still be the case that we would advise against travel for the same reasons, that we wouldn't want people to bring it back into Scotland. So, the future feels a bit brighter than it's done in a long time, but the future is still the near future is still quite uncertain, and therefore I wouldn't be giving people advice to book holidays for next summer quite at this point. Elsa Mishman from The Scotsman.
you, First Minister. Just to clarify on the genomic sequencing, the findings that we've discussed several times, you said it's become clear over the last while how important the travel is, and in hindsight, I think you said travel restrictions in Scotland could have been much tougher. Does that mean what we're understanding from these studies is that not closing the borders and relaxing those restrictions after the first lockdown, is it showing that those were mistakes, and would it have been much better to take an approach more like that of New Zealand, as Professor Leitch mentioned?
I mean, some people, I guarantee you there will be people who read it and describe it like that, and I've always been very clear, we will have made mistakes. It may be that we look at this with hindsight, and remember, we have hindsight now, we don't have it at the time we're making these decisions, and say maybe we should have done something differently. And I will never ever stand here and try to pretend that that has not been the case. We've reflected on this standing here many times over the past 9 months. New Zealand has taken a different approach in some respects to other countries. They've not been able to get through this virus with no changes to how they live their lives. They've chosen to effectively seal off New Zealand and not have people travelling in and out. That's, will be having impacts for New Zealand, but it has led to certain things that they're able to do domestically. That's a choice they've made. Every country has had to make choices. And Scotland is not New Zealand. Geographically, we're different, obviously. The degree of integration with our near neighbours is different. So some of those choices, had we taken them here, would have manifested themselves very different for Scotland. So it's not, yes, we compare different countries, but in doing that, you have to understand the different contexts that countries are in. And whatever we do has consequences, and there would have been consequences to that as well. But we try to learn as much from experience and adapt our approaches as we go on this as on everything else. And finally today, Mark McLaughlin from The Times.
Afternoon, First Minister. The front page of the Perthshire Advertiser yesterday, Henry Anderson, an SNP councillor, said he hopes that sports, culture and other entertainment venues won't allow entrance to non-vaccinated persons, that licensed premises will refuse entrance, and trains and buses and airlines. Now, you said this week that the case can be made for immunity passports. Is there anything to stop councils from making that case on a council-by-council basis if they want to restrict access to council gyms, for example? Can they? And do vaccinated people have any kind of proof of immunity, like a stamped appointment card or a certificate or anything like that?
With my apologies in advance to the Perthshire Advertiser, I haven't seen that front page from yesterday, so I haven't had a chance to see what the context of those comments were. On the specific question, could councils do that? I'd have to check the legal position there before I gave a definitive answer to that, so I'll check that and come back, because hypothetically, could councils take a view to restrict access to places on the basis of whether somebody had been vaccinated or not? Right now, and I'm going to hand over to Jason on this point, right now I don't think that would be a sensible thing to do. I mean, there will be debates and discussions, no doubt, as we go through a vaccination programme about the ethics and the philosophy of some of this, but just on a practical level, we don't yet know. And it's one of the things we absolutely don't yet know about this vaccine is the extent to which I think the findings from the trials say that it suppresses illness in people who have the virus, but we don't yet know whether it stops people transmitting it. So if you have the virus, whether you can still get the virus if you've been vaccinated and pass it on if you don't have symptoms, these are things that we are still waiting to find out as the vaccination programme moves on. So I'm not sure it would be a practical thing, a practically sensible thing to do right now, even if people concluded that it was ethically appropriate and sensible.
Yeah, that's how I was going to divide the answer, the ethics and the practicalities. There's a long way to go here before any of this becomes possible in terms of an immunity passport. There are exceptions in the world, but most public health doesn't work like that. You do need yellow fever certificates to go to certain countries where yellow fever is not endemic, for example. And healthcare workers need hepatitis B vaccination to do certain procedures and work in certain parts of our National Health Service. So there are exceptions, and we base them on evidence of transmission and evidence of risk. For now, at the early stages of what we know about both the virus and immunity from the virus, we're not in a position to suggest anybody should be doing anything any different, whether vaccinated or not. That might change as we learn more over the months to come. And the world will have to make some choices individually as countries, and the WHO will help us with that as it gets data from all of the vaccine trials around the world.
Thanks, Jason.
Question of proof, the second part of the question was...
No, we're not giving certificates to those who are vaccinated.
Thank you very much. That concludes the questions. Thanks to the journalist, to Jill for our interpretation, to Jason for helping me answer the questions. We've gone on for quite some time today, so lots of questions to answer as fully as we can. Tomorrow I will give the update in Parliament at 12:20 before the weekly session of First Minister's Questions. If you're able to, please tune in then. And in the meantime, please continue to abide by all of these restrictions. I know it doesn't get any easier with every day that passes, but you know we can see that light a bit more brightly at the end of the tunnel. But getting from here to there will still be quite a difficult journey, and it gets less difficult the more all of us continue to do all of the things necessary to stop this virus spreading. So please continue to do that, and my heartfelt thanks to all of you for what you have been doing so far. I'll see you again tomorrow and back here on Friday at 12:15. Thanks very much.